One challenge practitioners face on a daily basis in their clinical setting is explaining foot orthotic therapy to patients. Trying to explain the difference between a true functional foot orthotic versus something they can buy off the shelf in the pharmacy. I learned early on in my career that demonstrating the motion of the foot and the deformity of the foot using the patient's own foot as a live model was a very effective educational tool. And I'd like to take you through that with this simple little demonstration. Once you've had the patient walk and perform gait analysis, I recommend you bring them back into the treatment room and demonstrate to them visually with their own foot what you saw. For example, in this case, Mr. Jones, I want to show you the joints of the foot and how they move in your foot when I observed you walking. This is the ankle joint, okay? Underneath the ankle is another joint that allows a swivel type motion. This is called the subtalar joint. It's much different than the ankle, which is pure up and down. This is the subtalar joint. And then there's another joint right here. This is called the mid-tarsal joint. Do you feel the difference? When I watched you walk down the hall, you landed slightly on the outside of your heel, which is normal, but then your heel moved in this direction, which we call pronation. And that's your subtalar joint moving, and it moved all the way out to this direction. What that does to the final joint, the mid-tarsal joint, is it makes it loose and unstable. If your foot was brought back into more of a neutral position, that joint becomes solid or stable. This is a stable foot. This is an unstable foot. When I cast your foot for your orthotics, I'm going to correct your subtalar joint. I'm going to realign your heel properly, and I'm going to load your mid-tarsal joint so that it is stable. This position is what the foot orthotic will correct your foot to. A stable, solid foot compared to a loose, unstable foot. Now, also in this exam and demonstration process, we like to show the patient the effect of pronation on functional hallux limitus. Mr. Jones, when you pronated your foot, it drives this bone by your big toe joint upward. And I want to show you what happens when that bone is pushed upward. This is your first metatarsal. It jams the joint. So when your foot is pronated, that big toe only moves this much. But if I correct your foot and support it here, this bone can come down. If I support this part of your foot and let this bone come down, here's your range of motion. So look at the difference of this range of motion compared to this range. So ideally, we're going to support your foot and make this part of your foot drop to the ground more efficiently and let your big toe move normally. That's what a true custom functional foot orthotic will do for you.